Unit 4, Substance-Induced Psychotic Disorder. In this unit, we will be dealing with substance-induced psychotic disorders, and we begin with substance-induced disorders in terms of what are psychotic disorders and what types of such disorders exist. This is followed by the type of substances that could induce these disorders that lead to psychoactive substances. The causes lead to the substances and their effects, resulting in psychotic reactions, followed by diagnostic criteria to decide the substance-induced psychotic disorder. We then present the essential features of substance-induced psychotic disorders and bring out the differences between these disorders and the medically induced psychotic disorders. This is followed by the subtypes of these disorders and the specifiers. We then use different criteria to diagnose these disorders and make a differential diagnosis of these disorders. Then we take up the treatment of these disorders include hospitalization, onwards to medical care, counseling and surgical care. The prognosis and prevention are discussed briefly. So let us start with the psychotic disorders. Psychotic disorders are a group of serious illness that affect the mind, and this illness alter patients' ability to think clearly, making good judgment, respond emotionally, communicate effectively, then understanding the reality and behave appropriately. When symptoms are severe, people with these disorders, psychotic disorders, have difficulty staying in touch with reality and often unable to meet the ordinary demands of daily life. And this illness alter the person's ability. And however, even the most severe psychotic disorders usually are treatable. And different types of psychotic disorders include schizophrenia, schizoaffective disorder, schizophreniform disorder, brief psychotic disorder, delusional disorder, shared psychotic disorder, substance-induced psychotic disorder due to medical condition. So schizophrenia includes people with this illness have changes in behavior and other symptoms such as delusion and hallucination that last longer than 6 months, usually with a decline in work, school and social functioning. Schizoaffective disorder, people with this illness have symptoms of both schizophrenia and mood disorder such as depression or bipolar disorder. Schizophreniform disorder, people with this illness have symptoms of schizophrenia but the symptom lasts more than 1 month but less than 6 months. Brief psychotic disorder, people with this illness have sudden short period of psychotic behavior in response to very stressful event such as death in the family. Recovery is often quick, usually less than a month. Delusional disorder include delusions involving real life situations that could be true, such as being followed, being conspired against or having a disease. This delusion persists for at least 1 month. Then shared psychotic disorder, illness occurs when person develops delusion in the context of a relationship with another person who already has his or her own delusion. Substance-induced psychotic disorder is caused by the use of or withdrawal from some substances such as alcohol and crack cocaine that may cause hallucination, delusion or confused speech. Psychotic disorder due to medical condition include hallucination, delusion or other symptoms may be the result of another illness that affect brain functions such as a head injury or brain tumor. Paraphrenia, this is a type of schizophrenia that starts late in life and occurs in the elderly population. What are the causes of substance-induced psychotic disorder? Large number of toxic substances can cause psychotic reactions. In such substance-induced psychosis can occur in multiple ways. These include the following. People may inadvertently ingest toxic substances by accident, either because they do not know any better or by mistake. People may take too much of a prescribed medicine. Medicine may interact in unforeseen ways. Doctor may miscalculate the effect of medicine they prescribe. People may overdose on recreational drugs commonly used such as cocaine, or become dependent on drugs or alcohol, or experience psychotic symptoms while in withdrawal. Then, while the substance-induced psychosis is triggered and then sustained by intoxication or withdrawal, its effect can continue long after intoxication. And then drug of abuse can cause psychosis include alcohol, amphetamine, marijuana, cocaine, hallucinogen, inhalants, opioids, sedative hypnotics including medicines that are sometimes used to treat anxiety. Then common over-the-counter and doctor-prescribed medication that can cause psychosis include analgesics, aesthetics, anticholinergic agents, anticonvulsants, antihistamine, cardiovascular medication, antimicrobial medication, anti-Parkinsonism medication, chemotherapeutic agents, corticosteroids, gastrointestinal medications, muscle relaxant, non-steroidal and inflammatory medications. Environmental toxins reported to induce psychotic symptoms include anticholinesterase, then nerve gases, carbon monoxide, organophosphate insecticides, carbon dioxide, and volatile substances such as fuel or paint. These substances, these medications causes number of large toxic or psychoactive substances that cause psychotic reactions. And these substance-induced psychotic disorders, then it is common over the counter and doctor prescribed medications that cause psychosis also include these analgesics, aesthetics, anticonvulsants, antihistamines, and these medications, antimicrobial medication, cardiovascular medications, anti-Parkinsonian medications, then environmental toxins reported to induce psychotic symptoms. And substance-induced psychosis is triggered and sustained by intoxication or withdrawal. People may overdose or recreational drugs may commonly use the cocaine also experience psychotic symptoms while in withdrawal from those substances. Okay, bye. Thank you.